Welcome to Passive Curiosity in an AI world where we explore tomorrow's careers through the lens of AI. What if I told you that we're asking doctors to do something humans are actually bad at? Dr. Julia Adler-Milstein studies how to build systems that catch AI mistakes before people miss them. Let's get curious. Today, we're continuing our AI in Healthcare mini-series, and I'm excited to be joined by Dr. Julia Adler-Milstein. Dr. Julia is the founding chief of the University of California, San Francisco's Division of Clinical Informatics and Digital Transformation, as well as a professor of medicine. She's a national leader at the intersection of health policy and health informatics, with over 250 peer-reviewed publications shaping federal and state policy, especially around AI governance. Her work is frequently cited by the New York Times, NPR, and Politico, and she was elected to the National Academy of Medicine in 2019 as one of its youngest inductees. At UCSF, she's led major advances in applied clinical informatics, securing more than $40 million in research funding, launching new research centers, and partnering with UCSF Health to pioneer approaches to AI monitoring. Dr. Julia, thank you so much for joining us today.
Thank you for having me.
To start off, if your teenage self could shadow you for a week, how would you explain what you do, and what would surprise them most about your day-to-day work?
Great question. I mean, my teenage self definitely had no idea that my career exists because I think it was sort of doctor, lawyer. Those were the categories I thought of as career. And so, how I would describe it is that I get to do research, which is in and of itself, I think, the best career because you get to ask big questions and then you have to figure out how to answer them using data. And so it's fun because it's super creative and you always have to think about what's coming next. And then at the same time, you get to be really in the weeds, figuring out how do I answer this really hard question and where do I get to collect data? Where does data already exist? And so it's also for someone who really loves math. It's a great career because I get to use math every day, but it's not just number crunching. So that's why I feel like I love research. And then for me, being able to do research in the world of healthcare technology is just endlessly fascinating because healthcare is such a complex industry. And technology is so powerful, but when you put those two things together, technology can do unexpected things. So it's not always obvious the impact that technology has on healthcare. And so for me, that's why it's been so fun to be a researcher in this particular area.
I know you mentioned, right, at your younger age, you would have had no idea your career existed. What first drew you to health policy, technology, and healthcare?
I mean, my career started in management consulting, again, partly because I just didn't really know what was out there. I always sort of knew I was interested in healthcare. And so I got to work with a lot of large healthcare clients and just understand who are the players in healthcare, right? Who is CMS and who is United Healthcare and what does it mean when we say a healthcare delivery system? So I just felt it was a really helpful way just to understand the players in healthcare and also some of the complexity around how care is delivered and organized and paid for. But I knew that like consulting was not going to be the career that I wanted. And so from there, I hopped to the provider side of things and went to work for a large health system. And I really just got lucky that I ended up in a research group and got exposed to research because I had no idea that I was interested in it. And so I was a research assistant as just an entry level position. But I was like, oh, I really love research. And so that then was like, okay, I love healthcare, I love technology, I love research. And then the pathway clearly opened up from there. You go get a PhD and get training in how to be a researcher. But I did have to forge my own way in terms of studying my particular focus area, because at that point in time, there weren't programs that specialized in what I was interested in. But again, in research, there are ways to really pioneer your own pathway. And so I was lucky that I was able to do that.
That's really inspiring. Which parts of your training do you think mattered more than you thought they would?
Yeah, I'd say probably the most important part was being a good writer. I wouldn't have thought in a research career that your ability to write clearly was so important, but the ability to get grants is all about good writing, and the ability to publish your papers in prestigious venues similarly is all about good writing. So I spent a lot of time in my doctoral program just learning how to be a good writer, because that is, I think, the most essential but underappreciated skill in a research career.
In previous podcasts, you've talked about the limits of clinical vigilance. What does that mean day to day?
Yeah, so that's an example of an emergent topic in my field that we've been thinking about as something that really is in need of research as clinicians increasingly use AI tools to support their work. We know that these AI tools are imperfect. And in the case of generative AI tools, they hallucinate, right? They make things up that aren't truth. What we expect is that our clinicians who are using these tools will be able to identify when a hallucination has happened or when a tool is otherwise inaccurate or imperfect. And that's actually something that's really hard for humans to do in general, right? Is to look at something that's right most of the time and then catch the few instances when it's not right. And so I wrote that first piece as just a thought piece. Are we setting our clinicians up for failure by basically expecting that they'll be good at doing this? But now have gone on to see, how do we study this concept? How do we measure whether a clinician is being vigilant? How do we think about interventions that would help people be better at being vigilant? Or should we just give up on this concept and just say, this is not something that a human can do, and so we need to design other systems that will help catch when AI is making mistakes?
Could you give an example of what type of systems you would use to try to catch these errors?
Yeah, somewhat comically, I think we are thinking about how to use AI to catch another AI tool's error. And so there are sort of models that are emerging, referred to as like an LLM as a judge or an LLM as a jury. So they can start to check each other's output. That's like an example of a strategy that doesn't rely on humans, but will still be error prone. So it's not perfect. But again, neither are the humans in that case either.
Yeah, it's an interesting thought. Research and policy can sometimes sound abstract to students like me. When have you seen your work change how doctors use AI or EHR, electronic health records?
I think in the policy world, we think about research having impacts on state or federal policymakers. Some people who I think do policy research, their goal isn't really to specifically shape policies, right? Like legislation. And then for other people, I think that really is the goal, is for their research to change the way that a policy is approached. I've been a little bit more, I'd say both kinds of research, but for me, like, the goal is not to change a doctor's behavior, but is really to more change a policy decision.
So then, could you maybe give an example of one of the policies you helped change?
Yeah, absolutely. So I do work not only in AI, but for most of my career, a lot of my work has been around interoperability and how do we help health data move when and where it's needed to support patient care and other use cases. The federal policy framework to promote that, the start was pretty lightweight. So some of the work that I did was basically showing that there were like economic incentives that were inhibiting this sharing of information, particularly when two hospitals perceived each other as competitors. They weren't that excited to share their data with their competitor down the street. And so a lot of the work I did was showing that competition was a barrier to this data sharing. And then I won't say that was the exclusive driver, but there was a piece of legislation that then came after that body of work that basically started to create penalties for health systems and EHR vendors that were shown to basically be engaging in what was called information blocking, like not sharing information when they otherwise could. So that's an example of where I used data to show that there was a problem and then there was a policy response that came about as a result of that.
We hope that AI will ease burnout, but sometimes it accidentally does the opposite. Where do you see AI helping clinicians, and where do you think it might make things harder?
Yeah, that's a great question. I think what we're seeing with a lot of the first wave of AI tools that are being widely adopted, they're really focused on burden reduction. And in particular, we ask clinicians to do a lot of cognitive work, like taking in information, remembering it, synthesizing it, summarizing it. So I think the first wave of tools is really relieving a lot of the cognitive burden associated with clinical work. I think a lot of the studies that have come out have shown that AI scribe tools, for example, they don't save a huge amount of time, but clinicians report that they really decrease cognitive burden. And so I think that's a real benefit. But where I think, the flip side of that is that AI is also going to produce a lot of new information that clinicians may need to factor into decision making. So on the one hand, I think we'll have tools that reduce burden, but I think AI could also then increase that cognitive burden as there's more and more predictions that a clinician has to look at that are coming from an AI tool to say, oh, your patient might be at risk of A or B or C. And then they'll have to look at that output and try to figure out how that should factor into their decision making. So I feel like sort of anything that adds information could add burden, and anything that takes away the need to understand, make sense of, and process and write down information will reduce burden. AI, I think, is acting on both sides of that equation.
What kind of new roles or responsibilities are you seeing emerge now that AI is part of healthcare?
Yeah, I definitely think that AI has created a need for what we usually call AI governance, which is the oversight of tools, AI tools. And some of that is deciding what are the tools that any given health system needs, what are the problems they're trying to solve, and how do we find the right AI strategies to address those problems. So that's a strategic piece of it. And then there's the oversight piece, which is how do we ensure that this tool is safe and effective? And so we're seeing, I think, a whole set of new roles around AI governance that are doing that work that's, again, both strategic and oversight work.
What advice would you give a student who loves data, cares about patients, and is considering a research or policy path outside clinical practice?
Yeah, there are so many different kinds of opportunities at the intersection you just described. And so I think the advice is really figuring out what part of that world you are passionate about. Not everyone loves to do research. It's a lot of work to apply for grants and collect the data and write the papers. And so I really only recommend investing in a research career if you really think that you want to do the research. But a lot of people are interested in adjacent areas. And so going to work for think tanks, I mean, even going to work for state or federal government, there's so many ways to be involved or close to this work and world. Health systems themselves have policy shops within them where you get to think specifically about healthcare policy. So I think it's really about figuring out the skill sets and topics that you're interested in, and then finding the match to the types of job opportunities that exist for that. But again, a lot of them I think are not obvious from the outside that they exist. That's where I find talking to people, informational interviews, like snowballing, where you talk to one person who recommends the next 2 or 3 people to talk to. I think I was always intrigued. If I didn't do my current job, I might be really interested in working at a foundation that's trying to think about how do you use philanthropic support to have change and impact. Again, lots of different ways, I think, to either do the research or be in the world of research and policy.
That's very insightful. Sometimes it's hard to get the exposure to these different careers. Is there anything we haven't talked about today that you think students exploring AI, healthcare, or policy should really hear?
Yeah. I think what I've found is there are people who are technology people. They're excited about the technology part of it, right? And those people tend to be more excited about building the technology and developing it. And that's where they're drawn. And then there are people who I think are more interested in the humans, for lack of a better word, the human side of things, and are more interested in social science, the behavior, and how the healthcare system is organized, and what levers do you use to change behavior in a complex system. So I think first and foremost is thinking about where you fall on that spectrum. Are you someone who wants to build technologies? And then as you try to get those technologies into the real world is when you start having to encounter the messiness of how are things paid for and how do you sell a technology to a health system. So you decide how far in it you want to go. And then there are people like me who are very technologically inept largely. I couldn't program, I don't build AI tools, but I'm fundamentally interested in this question of how will AI tools change the way that humans do their work. And that's, again, just a totally different set of interests and skills. And so even though it all sounds like one thing, I actually think it's quite different. There's space for everyone to do their work, but that I found is a fundamental difference in the way you will find your place in this world based on which of those two camps you fall in.
One last question before we wrap this whole podcast up. Over the next few years versus the next decade, how do you think AI will change healthcare?
It's a great question. And I think it's the big question. I certainly don't feel like I know the answer to it. The biggest way that I think about where AI could be transformative is who is the gatekeeper of big decisions? And by and large today, it is still humans, right, that are the gatekeepers of big decisions. AI is enabling them to do their job with more information or more efficiently. But I think the question is, are we going to get to a point where AI is more the decision maker and the humans are flipped in terms of their role of more oversight and approval, but the thinking and decision making work really sits with AI? Will AI learn how to run a health system? And will it start to think about things that are at much bigger units of scale than the tools that we're working with right now, that are largely focused on pretty narrow problems? And so as I look around and think about how quickly will we move to a very different future, that's what I look at, is to what unit of problem is AI being applied and who is the decision maker around those questions. So I think in healthcare, for good reason, we're conservative and slow moving. I think it'll be a while before AI runs a health system, but that's transformative. And if and when that day comes, that's when we will know the future has really arrived.
Yeah, it will be slow due to all the regulations, but it is a fascinating idea. Well, Dr. Julia, it has been wonderful having you with us. Thank you so much for sharing your time and insights today. You remind us that progress in AI and healthcare isn't just about new technology, but about asking better questions, designing systems that actually work, and keeping people at the center of innovation. And for our listeners, if today's conversation sparked your curiosity, explore our AI and Healthcare Future Jobs Map and other resources in the show notes. This has been Paths of Curiosity in an AI World, exploring tomorrow's careers through the lens of AI. Join us next time as we continue mapping the future, one field at a time. Until then, stay curious.